Epidemiology Department. Thank you so much for being with us.
Pleasure.
Well, as the WHO launched its trial testing existing drugs to compare treatments, President Trump was touting the benefits of the anti-malarial drugs at his daily briefing. He talked about one man whose life was saved, but some people have actually died as a result of using these drugs. How much hope do you think these anti-malarial drugs offer, and do you support their use starting Tuesday, apparently?
It's an interesting situation because we've never been collectively so concerned about having drugs in place and needing them in such an urgent time. Now, these drugs that we're talking about, a specific type of chloroquine, are drugs that have been around since the 40s, known to be fairly safe and tolerable in standard doses, but they've never been used in this capacity. And there's very little data to suggest that they actually work. We worry about any kind of mass distribution of drugs, even in an emergency use setting, when there's not enough data on the safety and efficacy for this particular indication. So I think that the idea of giving this to so many people in such a short period of time without any understanding of the true side effects or the effectiveness of it is not well-founded.
Right. And President Trump also said at his briefing that he wants to open up the United States in a matter of weeks, not months, despite the rising number of coronavirus cases, because he says we're not going to let the cure be worse than the problem. What's your response to that?
I think it's not very well grounded in science or what we've seen from any other country. That we have to be learning from the global experience. We're not different biologically than people in any other place in the world. The countries that have been able to go through this quickly and be able to have less stringent lockdowns are countries that have personal protective equipment, that have massive capacity for testing and contact tracing. And they are unprecedented capacity and cooperation between all sectors, social, political, economic. And they have real national strategy and leadership, along with many more hospital beds and hospital capacity to manage the number of patients coming in. In the United States right now, we do not have those things in order. And as a result, it just doesn't make any sense that within 2 weeks we would be able to start opening things up.
The bigger part of this story, as you mentioned, the availability of ventilators and personal protective gear. Why do you think President Trump seems reluctant at this time to implement his power under the Defense Production Act? He's there, he hasn't implemented it, but he has the authority to do this now, to get companies to make more masks and ventilators, many of them, so people don't die and so the doctors and nurses are not putting their own lives at risk? And how important is it that he does this sooner rather than later? What's he waiting for, do you think?
I don't know, but I will say that it is critical that we have maximum capacity to be able to handle PPE, or to have enough PPE and to have enough ventilators and all of the associated supplies and equipment that are required to be treating the number of cases that we're anticipating here. It's not possible to be able to manage without the PPE that we need, and many people are going to die, and people are going to have to start making decisions about triaging who's going to get a ventilator and who won't if those things do not start coming into production. So as far as I'm concerned, the sooner that this happens, the better. We're already late. It's time to get moving.
And no doctor wants to make that Sophie's choice decision at all at this time or any time. And of course, we are seeing these two parallel universes right now of doctors and nurses working on the front line, saving lives and pleading for more personal protective equipment, while on the other hand, some people not taking social distancing measures seriously, not staying home, even out partying on beaches and in bars. How do you feel when you see these two colliding worlds? And why are people not getting that message loud and clear about just how serious this is?
it's an interesting phenomenon and a worrisome phenomenon. I think that it is so hard for most people to really understand that this is reality, that people are in a sense of denial, that they just can't believe that this is true, and changing behavior and getting people to do things that are so far out of their comfort zone is difficult even under the best of circumstances, but also when you're facing something like a virus, which is, such an existential threat for so many people. I think that that's the biggest problem. We've seen this. We've seen this with Ebola outbreaks in the Democratic Republic of the Congo and in West Africa. I've been working on Ebola for the past several years and working in the DRC for 20 years. And I'll tell you, epidemics are difficult, and they're hard to get people to act on for the good of society. And especially when it's not something that they understand, or understand the mechanism so well.
Just incredible, isn't it? Dr. Anne Rimoin, thank you so much for talking with us. And again, we salute you, we salute all of your colleagues, all of those out on the front line waiting for more equipment. We just find this extraordinary. But thank you so much for speaking with us. Appreciate it.
My pleasure. My pleasure.
And China's Hubei province has announced travel restrictions